an addictions physician based out of Toronto, and have a special interest in food addiction, both because of my own history and professional. And I spoke on Wendy's Finding Wendy talk, this thing, a couple of weeks ago about food addiction. And people started asking me very good questions that I can't answer about, but I'm a post-bariatric client and I can't do what you're suggesting. And then I thought, oh my God, David is the one that needs to address these questions. So David, you were a little bit too humble. I just want to say a couple things about David. He, in my work at Renaissance, we had a food addiction program, which a couple of people were in here. And he was the one that designed the food plan for food addiction that is not a diet. It is a sugar addiction, flour addiction program to remove cravings. And in fact, his website is called Trigger-Free Nutrition, which is exactly what we're interested in. And the reason why I thought about David for this is because he's worked with the post-bariatric crowd and had to do a lot of finagling and reformatting our food plan for people who couldn't eat like the 24 ounces of vegetables that I eat every lunch, or not lunch, but dinner or whatever. So he had to figure that out. And so he has that expertise and would be a great guy if any, I mean, he's here really just to answer questions, but if you want to get something planned for yourself, he's got that website called Trigger Free Nutrition and does this work. So contact him. So that's my ad for him and for me. And that's intro. Let me just do a summary of what we talked about, because a couple of people mentioned that they're struggling with food, COVID. Wendy, you mentioned. The food addiction perspective is really just to say, this is not a diet, but this is a way to understand why it is that we eat foods that we don't want to be eating, but we're still eating them. And it's because we're recognizing that there's an addictive quality to those foods. And for some of us, more so than others of us. So our family members might be able to get away with this stuff, but we can't. And understanding what the triggers are, and then learning how to manage them from an addiction platform is the goal. So that would be from an addiction framework. Let's find out what the triggers are and then remove them. And then guess what? After you've gone through withdrawal, which we can talk about, it takes a few weeks, then those cravings will quiet. And for the person who said they're still struggling, it's not just sugar, it might be flour. And for some people, especially women in postmenopause, it might be grains too. You got to figure out what those triggers are. That's the kind of stuff that David would do with you. What are the triggers that are keeping the cravings going? Because the goal is to be free of cravings and just to eat when you're hungry and be happy with that. We have a food plan, which is no sugar, no flour, and possibly no grains. But what do you eat then is the big question. So David, did you want to say something first? And then I think we should open it up to questions, because people had some great questions a couple of weeks ago, and there's always new questions.
Yeah, so sure. So we know that addiction is a brain disease, right? And so it manifests in the brain. So one of the things that the surgery identifies is or takes into account is that we're rerouting or adjusting your GI tract, right? So we may be rerouting your small intestine with R and Y, or maybe making your stomach smaller in a sleeve. And some people who have had lap bands, same kind of idea. But so the brain isn't adjusted by the surgery. So that's one of the reasons that addiction will continue throughout the surgical recovery process. And so what I found, so I worked in a bariatric center for 3 years. Largely, I was trying to treat addiction. Anyway, so I used addiction treatment techniques to help people. What I found was that basically most people would plateau weight loss around 6 months if they were addicted or appeared to be addicted. And then at the year point, they start to actually put weight back on. So that was kind of, when I was watching trends, that's really what I saw. But I think the best thing to do is answer the direct questions that people have. Because that will probably serve them best, Vera.
Oh, sure. And by the way, you have a book. Do you want to just mention your book?
Sure. I wrote a book with my dear friend, Cynthia Myers Morrison. It's called The Fix for Cravings. It's available on Amazon. It's also available in Canada on Amazon. And it includes a food plan, but also just, it's really a how-to book, steps that you can take. There's a process to follow to really work with others and change your life through this process. And Vera wrote the doctor's opinion, and so it's definitely worth reading. We're excited to have it out.
Yeah, and lots of stories as well.
Oh yeah, that's right. Yeah, that's right. We have
Yeah.
stories, success stories in the back. Really helps people identify, is this me? Is this not me? That can really clear it up.
Okay, well, I remember that a couple of people were asking questions about volume and, what can I eat? Because I can't eat as much as you, Vera, because I haven't had the surgery.
Right.
But so anyway, come forward, some of you folks, give some questions. Be specific. Yeah.
Hi, I'm 13 months out and I've done really well with my sleep. And
Okay.
I'm pleased with how my progress is going, but I'm a little bit confused about how much I'm supposed to be eating at each meal. So right now, I sort of measure a cup. So whatever I'm having, I measure a cup and that's my meal. And sometimes I'm worried that maybe that's not too much. Maybe it's too much or maybe it's not enough.
Mm-hmm.
Is that being consistent over a period of time, or the volume?
So, pardon me?
Has the volume been consistent over a period of time? Is it a new
The
level,
volume,
or are you needing
no,
that?
that volume has been consistent from, I would say the last 8 months.
Yeah.
And I'm losing, of course, I'm losing at a smaller rate, which is fine. I'm losing, maybe a couple of pounds a month now. I'm just confused about moving forward. Is that normal? Is that normal?
So after your cup, do you feel full, like you feel restriction?
No, I feel like it's enough.
Does it?
Yeah. It sounds like you're right where you're supposed to be. I think the body gives those signs. It's problematic when we also have the mental obsession for motion, because it just makes it more complicated to decipher like what is true and what is not true. But it sounds like, based on the physical signs that your body's giving you, that you're eating the right amount for where you are in your journey.
Okay.
Can I ask you a question, Dorothy? A cup, is that like equivalent to maybe 8 ounces of veggies? Sort of?
I don't know.
So
Today for lunch, I had a black bean salad and I just measure out a cup. So
Okay.
I do a lot of casseroles. So I do like the lazy cabbage roll casserole, and I'll just measure a cup.
And it fills you. How long does it fill you for? Like
Till the next meal.
Really?
But one of the things I'm concerned about is right now, my mind is really great. Like I think I'm sort of still in the honeymoon phase, so my mind is quite strong. So that's why I don't know if I don't know. I just worry that I'm not maybe eating enough.
Why?
I don't feel hungry. I do find with COVID, we're snacking a little bit too much.
So you're eating between meals then?
Yeah, I'll have a snack if I need, but it'll be like a small apple.
Okay.
Or a little bit of cheese and crackers. More of the snacking is happening in the evening.
Okay.
Dorothy, can I interject there? Just a reminder, when was your surgery again?
May 1st, 2019.
Oh, 2019. Okay, so yeah, you're just past a year.
And my weight has been somewhat stable the last month, I would say.
I would say that for myself, and I just wanted to interject, the important thing about this journey is that the establishment of habits, and that the habits of weighing your food has to continue also into year 2 and into year 3, and that your retraining your brain about portion control, and that the portion control is like, at one point your stomach will not be able to give you the trigger you're full, because there is, like, post-surgery for the first year, you feel full real fast. I had a sleeve. Did you have sleeve or RMY?
I had a sleeve.
Yeah, so I can eat way bigger portions now than I could 6 months out. And looking back at our guide that we got, our bariatric binder, that we got post-surgery, and looking back at weeks 1 to 4, and you see the portions of your food is a quarter cup. And that again is like a shocking, like, oh my God, post-surgery, 6 months post-surgery, I only could eat a quarter cup of food and then I was full. But if you're getting into the habit of constantly weighing your food, even past the first, the second, the third, and the fourth year, that you are, even though you don't feel full, you've had your appropriate portion. Because that's really the key. I just wanted to interject that for a second, Dr. Tarman, about the portion control with bariatric patients, because it's really about habit forming, and the habit forming of always measuring your food, because your stomach will stop telling you you're full, for sure. And then you're just like, whoa, I ate so much. Oh shit, I should have measured this.
Yeah.
And then the other, just one little small trick, if you've eaten a cup of food and there's still food on your plate, get up, put the plate in the fridge or in the garbage and wash it. Don't leave it around, because you will continue snacking from the plate.
I do find that with the snacking and I feel I'm going to have to cut out the snacking.
Yeah, can I say something to the snacking, because that pricks my ears right away. I in the food addiction platform, advocate that people don't snack. They have 3 meals a day and that's it. Because there is the concept of, you want to fast in between, a proper fast. If you're not going to do I'm not a great fan of intermittent fasting, which is prolonged fasting, but we still want to not have periods of time when we're not eating. And the snacking is a sneaky, it's the foot in the door. And I also heard you say that you snacked on cheese and crackers. Okay, David, do you want to take it from there? Because I think we both feel the same about this.
Yeah, so a cracker is bread, and bread is flour. And so, and flour is like a white powder. So it's pretty close to sugar. So I would cut that out. I like to tell people, because they identify with this, like, I call a snack a nip. I don't know what do you call it in Canada? Like a 1 ounce bottle of alcohol.
Yeah.
So I mean, idea is, in and of itself, is a snack is an emotional decision. It's more than a decision to like eat for fuel. And so I also discourage intermittent fasting, but I like to call it like time restricted eating. Like, we don't eat between meals. I think that's definitely a practice, because it gets messy, and it's not, it's usually not food. It's like, it's more of like, I'm eating feeling, or I'm eating to have an experience or something like that.
I have to agree. I totally have to agree, because since I saw the snacking coming in, it is that, it's the stuff that brings me a little bit of joy, like the crackers. And I think that I kind of know that I have to go back to 3 meals a day and nothing in between. And if I need something at night, maybe a small apple or something.
Or maybe you're not having enough at dinner. Like, that's not sustainable.
No.
And you have more fat or more protein.
No, the snacking really has nothing to do with being,
Okay.
it's really, bored, or it's that.
Okay.
It has nothing to do with being hungry. So when you say no crackers, what about the seed crackers?
No.
No,
I wouldn't eat crackers.
Now, how do you really feel about it? No crackers whatsoever.
I wouldn't eat that.
That's easier to negotiate for me.
Yes,
like,
it
it's easier to say I don't have it than try to negotiate.
Right. Because the food plan should be clear. Do you know what I mean? We don't want you to have much wiggle room. because I guarantee you, you're going to wiggle. So if there's room to wiggle, you wiggle.
The addict wiggles.
The addict wiggles. Yeah. Squirms even. So yeah, cut out the wiggle. That would, I think, serve you really well.
So your plan also no to popcorn?
Yes.
Yeah.
Correct.
Oh.
Okay, I have to go now.
But if you're asking, Dorothy, if you're asking why,
But your reluctance to give up popcorn is a message in and of itself.
exactly. Plus, there's that weight stall.
What's the message?
That you probably shouldn't be eating it in the first place.
It's sticky, right? It's a sticky thought.
Yeah.
That's how it starts. And by the way, that weight stall, you ask your question, you know, like, what is it that's slowing it down? There's the carb there. Popcorn is a carb. It's a refined, yeah.
It's corn, yeah.
This is like a come to Jesus moment.
Oh, yeah, we do those.
Yeah. Thank you.
At the time, but
The truth can be highly spiritual, yeah.
Were you about to say something, Rosalind?
Oh, I do have a question for David, yes.
Good.
I'm probably out farther than anyone, but I remember them always saying you make sure you have your protein first before anything else.
Right.
Now, if one was to change to a plant-based diet, I guess you can get protein out of other foods. So how would that work?
So my first recommendation is, if it's possible, to not go plant-based, because it's going to really limit you, and it's going to be really difficult to get what you need. There's a lot of information that's coming out now that's suggesting a lot of the reasons why people go plant-based is for the environment, and the reality is that if anything is harming the environment, it's industrialized farming. So I have this theory, and I'm an opinionated guy, you know. I have this feeling that greenhouse gases are probably caused by greenhouses, and that's where most of our produce is grown. So, and then that these items that we get alternative protein sources from, like soy, aren't so good for the body. They mess with our hormone systems and our thyroid and things like that.
I can attest to that for sure. I mean, David is, the thing about David, this is why I like him so much. He's not like your standard nutritional, internet nutritional coach that's talking. He's actually trained, with medical research about what is safe and what is not safe. Like, for example, soy it's an alternative for sure, but it's not a very healthy one. And so take. In as much as the medical world is on board, he knows that information. So I just want to vouch for that.
Then
Does anybody else have any questions?
The other thing is, she mentioned, which is important, it's important to prioritize protein, but the main reason we need to prioritize protein is because it's what we call an essential nutrient. We can't store it. So we can store carbs in our muscle, and we can store fat. Well, we all know that, right? Because we store it in our fat, but the protein needs to come throughout the day. So that's why it's essential. We can't store it. So, and we can only utilize so much of it at a time. So if I give you, like, just hypothetically, if I give you 10 ounces of meat, you can't use 10 ounces of bioavailable protein at once. So that's why you want to make sure that you're having it at most of your eating occasions, if not all.
Okay, thank you.
It also helps keep us full.
David, another question, can you give a very, very basic, for a bariatric client, food plan, like 4 ounces of protein at breakfast, like not specifics, just basic, because I'm not even sure.
Yeah, so it's probably about 4 to 6 ounces of protein. Let's assume we're eating like 3 or 4 times a day, 4 to 6 ounces of protein, and then some vegetable, I don't know, maybe 3 or 4 ounces, and probably
for each meal.
Yeah, so some people follow the cup system. So yeah, I would say like probably 4 ounces of protein, 3 ounces of vegetable, a half a tablespoon to a tablespoon of fat.
Wow, that's not very much.
No, we have.
No, it's not a lot of volume, but it has everything that a food plan like yours has, minus the veg volume.
Yeah.
Right, and I work with. Go ahead.
Oh, sorry. I was just going to say to clarify that this binder that we received of the food plan that we're supposed to follow in Ontario for the first 6 weeks involves, first of all, 6 meals a day, not 3. And the in between meals are basically protein fillers. And we were told to have either cottage cheese or Premier protein drink. But my point is that the binder that we're sent home with or been studying with pre-surgery and then after surgery is filled with sugar and crackers and flour.
Yeah.
So it's something that is a brand new subject for a lot of bariatric patients because we follow our nutritionist from our hospital who says yes to carbs, yes to crackers, yes to sugar, but at all limited amounts. So when we would have a meal, it would always be quarter cup size meals, portions. And, you would have yogurt with sugar in it. You would have Melba toast with cheese on it or hummus. So the flour and the sugar was in our system right after surgery.
Mm-hmm.
I have a question about protein. Going back to what Rosalind said, the reason I can't have meats is because I have a hernia that compromises my intestines, and I'm waiting for surgery, but the meat won't go down, whether it's chicken or beef or any kind of meat. However, legumes like beans have sugar, so it kind of counteracts with my wanting not to consume carbs. I'm guessing dairy is the same, like cottage cheese has, like what would be an ideal protein that I could have other than eggs, which I'm aware of, that doesn't involve meat or soy products?
Yeah, so, and fish is the same for you?
No, tuna is good.
So I would say I would prioritize seafood if you could. I would use dairy more as a supplement if you could help it.
Like the sugar in dairy is okay to some degree, is it not, David?
What's that?
The sugar in dairy, like the lactase, is okay to some degree to have like a limited amount of dairy, right?
Yeah, like depending on the person.
Yes.
Yeah, I would say that's true. Some people it's very triggering, and some people have no issue.
Yeah.
So like if you were going to eat yogurt in a situation like that, I would probably eat plain yogurt that's pretty close to full fat.
Yeah.
I know your system of fat percents is different than mine, but if it was made with whole milk, it would be better.
Okay.
The other thing is, I don't know if you've tried, like some people can do ground meat, some people can't do ground meat. So it's just like, it's like, unfortunately, we're like, science has come down to its initial tool, which was trial and error.
Yeah.
So really that's.
I was asked to be on a low residue diet, which of course is the total opposite of.
Right, but that's no beans.
Huh.
Yeah, no fiber. That's a problem.
Wow.
Right.
But I seem to be doing okay with a cucumber or some spinach. I seem to do okay.
Right. Yeah. The wetter stuff. So when is the surgery scheduled for?
I don't have a date yet because weight loss has to come off first, and I'm 6
okay.
Stop, so.
And you had your surgery when?
December. So I'm about 6 months out.
Okay. Yeah.
And I lost about 80 pounds.
Wow.
I see.
Okay.
So it was a hernia that manifested more recently.
It was an incisional hernia from when my appendix
Okay.
burst.
Yeah, they're going to want you to lose as much weight as possible before you have that done.
Yeah.
Yeah, it's kind of like a catch-22. What do it's like,
what's your
six
opinion?
of one and half dozen of the other. Go ahead.
Your opinion about protein drinks. I've heard that a lot, and I'd like your opinion.
Yeah, so essentially, if we have the capacity to be addicted to sugar, we have the capacity to be addicted to artificial sweetener.
Uh-huh.
And the drinks are full of it. My theory is that to a point they're needed in the beginning, I think. But if we can wean off them, that would be ideal. kind of look at the surgery like it's a detox, you know, for in the beginning from the foods that we were eating previously. And so, but if we're keeping things going that have sweetener or sugar in them, then it's not you've never withdrawn, right? And so I know people in recovery who have been in recovery a long time, and then they decide like they want to get rid of their sweetener, and they've been abstinent for a while, and they go through levels of withdrawal from sweetener. So it's not a doubt in my mind whether it's addictive or not. But there are some that are better than others, but really, if you can get away from them and meet your protein goals without them, you're much better off.
And while we're on the subject, what about those little cutesy bars, protein bars and?
Yeah, that's candy with protein in it. I'm like the bad news bears guy. That's like people paying me to get bad news. It's kind of ironic.
Well, it's the whole point of this meeting anyway is taking a different approach. If you've tried your keto, you've tried Weight Watchers, you're at a point in your bariatric journey where you're seeing a regain, or you're seeing that you haven't really kicked the habit of binge eating. And that looking towards the food groups that you want to have in your life, if those are the triggers for your binge eating that's creeping back into your brain, and that if you're like what Dr. Tarman talks about in her book is that the best way to figure out what your trigger food is to remove it. To see if that's basically if sugar is your trigger, if the protein bars are your trigger. Looking for a food group that you find that you want more of, like cheese and crackers. The crackers is the trigger. And that so that if you're wanting to continue on with your journey, as I'm always looking for working a lot on my mind. You have to constantly be working on your mind during the journey to make sure you don't fall off the wagon.
Yeah.
Right, exactly. It's a journey, right? Like you're saying, and then you're going to pick up pieces of evidence along the way, and it's just your job is to handle them as soon as they surface, but you don't know when they're going to surface.
Does anybody else have any questions or comments that they'd like to ask Dave?
Well, can I just, I want to go back to this, if you don't mind,
no, go ahead.
It looks like, the plan looks like, so 4 to 6 ounces of protein, and then we're really literally talking maybe.
Well, so it depends where they are in their story. If they're like early in their story, then that would probably be split. That same amount would be split. Like each meal would be half. Does that make sense? So like you might have to split your breakfast into 2 pieces, and then it would be
6 meals.
Right, it would be like 2 to 3 ounces. Right.
Okay. But then that changes. But the veggies, like, is that really sustainable? Like, I'm somebody who eats.
So, I mean, I work with some people that don't eat vegetables at all, and they do fantastically well.
And just 4 to 6 ounces of protein and fat?
No, they usually eat more protein. This isn't necessary. I'm not necessarily extrapolating from the bariatric population. I'm just saying there are people that don't eat vegetable matter and do fantastically well. So I know the veg count seems low. But a lot of the people that I work with, I would say that they wouldn't be able to handle like what you're used to.
No, the stomach won't be able to take it.
No, and I mean, I don't even just mean the bariatric population. I mean, just in general. Because it's a lot. I mean, for not that it's a bad thing. It's working marvelously, right, for you. But it's definitely one size doesn't fit all for sure. And you know that.
Yeah.
But when we can fuel with nutrient dense food, right, like the proteins and the fats, then the vegetables, what they really provide is like that like fullness, that like physical feeling of fullness.
Yeah.
But it's not necessary to have that in order to build and maintain abstinence.
So
I would say for some people it's very helpful.
Okay, so give an example then of what a meal might look like that's more nutrient dense but less on the veggie, just for people as they're.
You're talking about for a bariatric population?
Yeah.
Yeah, so I would just probably eat 1 or 2 more ounces of protein, and the fat might go up by like 25 or 50%. So instead of like a tablespoon of oil, it might be like a tablespoon and a half, and instead of like 4 3 or 4 ounces of meat, it might be 5 or 6.
Okay.
So it's just a little more of the protein and fat, and as the vegetable matter comes down.
Okay, just to belabor a point here, I'm hoping that this is helpful for other people. So that might be like a plate of salmon, like 4 to 6 ounces with a little bit of extra fat, and then maybe a few asparagus stalks thrown in.
Yeah, or none, depending on what the person can handle, but yeah.
And that will sustain them until their next meal.
Yes.
Okay, all right.
Right, because if you look at, like, if you're just, God forbid we look at the calorie paradigm, because it's awful, but
Yes.
but the where the calories are coming from, right, even in your food plan, right,
Yeah.
predominantly is protein and fat.
Yeah.
So we're just limiting the mass, but we're not really limiting the energy that's being provided.
Okay, I see.
By much, because vegetables don't carry much.
Right. Okay. That's why I'm asking you to speak and not me. This is great.
I hear you. No, that's good. I'm happy
So
to speak.
Dave, I have a question regarding carbs then, because there's a lot of controversial yes and no conversations, even with my own nutritionist at Toronto Western Hospital.
Okay.
In her own office, I would see a display on the wall of the foods we're allowed to eat, and there is a big box of cereal, breakfast cereal.
God. Yeah.
And I point at it and I said, I thought we weren't allowed to have carbs, and i.e. breakfast cereal. And she said to me, no, Wendy, your brain needs carbs. You should have carbs.
So basically you want me to debunk the myth, or?
Well, what is your opinion?
Yeah,
Debunk the myth, whatever your opinion is.
You have 2 fuel sources, right, that we can use.
Yes.
We can we can't use them both at the same time very well. So we have to burn one or the other. So when we burn glucose, which is a carbohydrate, we can use that for fuel, or we can burn ketones, which is derived, what's called the ketone body, which is derived from the breakdown of fat. So the brain can be fueled with ketones. The whole body can be fueled with ketones. The question I have is, were we originally designed to burn ketones, or were we originally designed to burn carbohydrates? Because if you look at the ancestral diet, this is before farming, basically we picked the vegetables that were around, maybe some berries, and then we ate meat and animal products. So we can't really decipher what system they were burning, but it seems like they were more likely eating larger amounts less frequently, and using what we were talking about before, like nutrient dense food. So you can definitely survive without carbohydrates. I have a lot of my clients thrive without carbohydrates. It's just a matter of kind of finding your sweet spot. Like, what is the right fuel mix for you? And that can take time. But as far as breakfast cereal goes, it's probably not a good choice. It's definitely not a good choice. It's not going to fill you up. It's like, kind of look at what happens when you chew something. Like, they're like the processed food industry has literally designed foods that disintegrate in your mouth, so that you will eat more of them, so you will buy more of them. Like the Dorito was specifically designed to have what's called a very small bolus size, which means that by the time you shoot a Dorito, it's minuscule. And that's why you can eat so many of them. Well, also they're addictive, but that's besides the point.
Well, yeah, in the bariatric world, we call them slider foods.
Okay, yeah.
Because it goes
Slider
straight
foods,
through.
binge foods, right? Whatever you want.
Well, it goes through your system the quickest. It does.
Right.
Disintegrates in your mouth. Disintegrates.
Right.
In
So
your
cereal
stomach.
does the same thing. I mean.
Yeah, popcorn does the same thing.
And also the idea that we don't want you eating solids and liquids at the same time, where breakfast cereal is a solid and a liquid at the same time.
Yeah.
Right.
That's right. That's right.
I don't know. Does that answer your question?
Well, yeah, you touched on a very interesting topic right there at the end, the 30-30 rule. So what's your experience with that?
What is that?
Yeah.
Oh, bariatric patients cannot drink 30 minutes before they eat.
Oh, okay.
I mean, they can only drink 30 minutes before they eat and drink 30 minutes after they eat.
So, okay. I think that's important because it allows the food to stay in the stomach, so it's not like forced to leave too quickly, which could lead to earlier onset of hunger. So especially if there's fat in the meal. So that one of the purposes that we use fat is it keeps food in the stomach longer. And since you've lost quite a bit of your stomach and you've lost quite a bit of your stomach's ability to produce hydrochloric acid, so which is essential for the breakdown of essentially those protein dense items, those proteins and those fats. So we want the food to dwell in the stomach as long as we can.
So no
yes,
drinking wine while you're eating.
right, or anything. Yeah.
Ah,
Yeah.
Yeah, so you're having a bowl of soup. You have to wait 30 minutes before having anything solid, or that soup will
Well, I
wash
mean, you have
everything
to
away from your
find
stomach.
you have to basically, my opinion is if it's not pragmatic, you ain't going to do it. So it has to be practical. I don't know if I would suggest that someone does that with soup. I would definitely suggest that they don't utilize soup as a primary vehicle for nutrition, but yeah, so you have to find a balance. But I don't know if I would go so extreme as to say, well, you had a bowl of soup, you got to wait 30 minutes before you can eat your salmon. But the other thing is, I was just thinking as you were talking, is these protein shakes. So you have some of the premier products have between 30 and 40 grams of protein, but it's a liquid and it's not going to have much dwell time in your stomach. So are you really getting 30 grams of protein? Probably
you're not
not.
absorbing that all, are you?
Probably not. I mean, we can't prove it, but
That's a good
Well,
point.
that's what it's interesting and frustrating at the same time, because all of us have been monitored by our own professional nutritionists at a hospital.
Yeah.
And then you hear something that makes complete logical sense to me when you say you drink a premier protein drink, it's not going to be sitting in your stomach very long. You're not absorbing the protein. So
Right.
Why are these nutritionists not telling us, or why are they creating
well,
this
they're just passing along
binder?
what they've learned or what they've
I
been
guess.
told.
Yeah.
It's the same reason that why we push whole grains and push cereals is just so inherent. So people like me and Vera have we're like the voodoo people as far as medicine goes,
You're the controversial side, yes.
Yeah, well, yeah, we're looking at medicine from a completely different angle.
Right.
It's becoming a more populated angle, but still.
Yeah, and it's very unfunded. So the
extremely, yeah.
The kind of dietary advice that you're getting is funded by the food industry, basically.
Yes,
so
of course.
We have to think about that.
Right. And also I'm suggesting that you don't eat any of the foods those are the companies that are funding the system.
Yeah.
So that might be part of it too.
Can I also say, Wendy, to something that you said earlier about does the brain need carbs? If you do need carbs because you're running a marathon race, like people will say, I've got a carb load, can I, and David, please correct me or add to what I'm saying, but we will make our own sugar. It's called gluconeogenesis. Like the liver will actually make sugar if necessary for fuel, if necessary. So we don't really need to have it because we have a system in place to get it if we need it.
Right. The other thing is that if you are burning ketones for fuel, if you're in what we call ketosis, then during exercise, your blood sugar will go up. Yeah. Right. And that's normal. Your body is, what Vera's talking about, is creating glucose to sustain your exercise. That's totally normal. To have a post-exercise elevated blood sugar, that's healthy in that situation. So that's totally right. And people can actually sustain long distance exercise without carbs.
Yeah. And World
In
Health.
fact, 30 minutes into exercise, you start engaging in what's called the Krebs cycle, which is literally like a fat fueled system. So.
Good. I was going to say the World Health Organization says that we are allowed to have, I think for women, it's 3 to 6 teaspoons of sugar a day, something like that. But that's the maximum. We don't need any. When you see those limits, it's talking about don't have more than that. But you can go from 0 to that much.
Yes, closer to 0.
Yes, closer to 0. I'm with you on that one.
I know.
So for those of you who are struggling with your food, ask these questions because I don't know the answers to these, but David does. ask you, David, can you comment on the Optifast? And
Optifast is, I mean, I don't know the exact product. I mean, I've heard of it, but it's a liquid nutritional supplement. It's probably awful. I mean, I would imagine.
Well, can I just interject about what the Optifast? So I was specifically told, because of my size, that I had to be on Optifast for a month. What the Optifast does is that it does give you the nutrition for a month, but the most important factor of the Optifast is that it shrinks your liver, because the liver is the way the surgeon had described it to me. Your liver is right on top of your stomach, and he has to be able to get to your stomach easier with a smaller liver. So when I actually had the surgery, I had my gallbladder out at the same time as having the sleeve surgery. And the sleeve surgery was almost canceled, apparently, because my liver was still so enlarged. But he was able to do it. But my liver has, I guess, shrunk, hopefully by now. But being 450 pounds, of course, my liver was huge. But the Optifast is to help shrink the liver, to help the surgeon during the surgical procedure.
Did it have sugar in it? I mean, I'm just wondering if that's what
so I can reverse the non-alcoholic fatty liver disease, right? Which is called NASH. In 4 days.
Okay, so
just remove all the carbs.
So why is it that this information would not come to a hospital? Is that again because the people at Optifast are paying the nutritionists in the hospitals?
It probably, I mean, there's probably a lot of avenues that are just really broken. I think part of it is funding and money. Part of it's is negligence. Part of it's that we're not going to get our national boards of nutrition and medicine to buy into this stuff because they think we're nuts. So,
if I had the choice of doing Optifast for 4 days instead of a month, I mean, I would say the bariatric surgery and the bariatric journey was far easier than doing a month of Optifast. That was the hardest thing I've done in my entire life.
Yeah, and so, and if you do not consume any carbohydrates, if you just ate meat and fat for 4 days, I mean, not like, I mean, in measured, in you know, the appropriate proportions, then your fatty liver disease would reverse yourself. It's just a matter of but if you did it for the first 4 days and then you went back to your other eating pattern, it's going to come back.
But there's another factor to that, Dave, that I do have to mention, is that there are 2 patients at the Toronto Bariatric Clinic at Toronto Western that were denied surgery during surgery because the surgeon found food in the stomach. So if the surgeon finds any food in your stomach, he will close you up. So there is, again, we're stuck. Our hands are tied. We cannot have a 4-day low carb diet because then surgery won't happen.
Well, then this sounds crazy and it's probably not right for the addiction community, but the alternative is to fast. But that's like, you know, that's not good for people like us.
No.
But it would eliminate you from having food in your stomach.
Yeah, I'm just sharing what we were told and what we've experienced.
I understand.
During this
so they didn't eat, they followed the regulations for their surgery, meaning being non-par oral for a period of time, and then they had food in their stomach?
Well, no, prior to surgery, you need, like I had to do 4 weeks too. In my case, it was Slim Fast, not Optifast.
Okay.
Slim Fast doesn't have aspartame, which causes headaches in some people. But so no solids, only clear fluids like Jello, broth that's no more than 10 calories, water, tea, but absolutely no solids. So
it makes no logical sense because the only form of calories that you're consuming are carbs.
Yeah.
Therefore, why would it even shrink your liver? It might help you lose weight. It just breaks my head and my heart.
But I did go, I checked and I was on ketosis with those milkshakes. Now it was those, not milkshakes, but the Slim Fast. I was supposed to have 4 a day. I couldn't handle 4 a day. I could only do 2 a day, and then the broth and the other liquids and stuff. And I was on ketosis. So that's why I thought, even though it has carbs, because it is sweet, it did send me over, like, I was on ketosis, so yeah.
What, you were basing it on urine tests?
Yeah, yeah.
Oh, okay. There was
But
another
it is
question though.
hard.
So the other question to address was Taz was asking about the food plan. I mean, there's no food plan that's going to work for everybody. It just doesn't exist. And so was she referring to the program at Renaissance?
Yes, I was.
Okay, yeah. So yeah, it may not work for you. Are you type 1 diabetic or
2.
type 2 diabetic? And okay, so yeah, the other thing to really think about is there's something called post-acute withdrawal. And so we don't know when that's going to come. I mean, there are some patients that seem like they experience pause at like week 3, and sometimes it comes at like 6 months. So, but it's basically like we feel like we're doing really well, and then all of a sudden, it's just like boom, our life explodes, and it's just not pretty. So it may be that your fail point is actually post-acute withdrawal, because when I explain that to people that I'm working with in groups, they're like, why is it that like every time I hit week 7, I'm just like, I'm a bear, you know? And it's just like, or week 4 or whatever it is, that's something that needs to be addressed, because if we don't have the tools in place to deal with post-acute withdrawal, because we've left the treatment facility, we're no longer there, we're no longer in a controlled environment, we're living in our home and doing our life, and then we get hit with what we were getting at a lesser degree, but what we were in treatment for, then what do? We need tons and tons of tools.
Hi. Yeah, just a quick question. I just wanted to ask regarding protein, the protein of eggs, and like, you know, how much you actually can have, you know, how many eggs are you allowed a week, like that type of thing, or is there any limit to that? Or
yes, so we've been duped by the concept of cholesterol. I mean, cholesterol is a naturally occurring substance in our body. We make it. Our hormones require it. Our sex hormones are made partially of it. It is not the problem. So, I mean, I ate 6 eggs for breakfast. I mean, eggs, do not have to be afraid of eggs. Yeah. Especially if you can get grass pasture raised eggs. It's a highly nutritionally dense food. And don't skip on the yolk either.
Okay,
Eat
perfect.
the whole egg.
Okay.
Yeah.
Well, that's good to know. Thank you so much.
Yeah.
I love eggs.
Yeah, me too.
Yeah, I mean, I probably buy 4 dozen eggs a week for my family, and there are 2 adults and a baby. So.
Oh, wow. Oh,
yeah.
that's great. Thanks kindly. Okay.
Maybe
I have a question. I have a question about oats. Can I ask about oats? So when I'm making, I make a meatball, I make meatballs, and I use oats as kind of a filler. So is that going to be a bad carb?
Well, again, I have an aggressive stance. I don't know of any good carbs, so I just kind of put most carbs in the bad category. You may be able to bind it honestly with like dried Parmesan cheese.
Okay.
You know? And I make meatballs without that stuff, and they come out just fine.
Okay.
Dorothy, you know, you said earlier that you struggle with weight stall a little bit, and or at least that was the implied. And then also you're in the food addiction thing. It just makes me think you're struggling a bit. So maybe that's the food, those grains. So David is more.
I would say it's probably not maybe.
Yeah, I'm being polite. So I'm not as aggressive with David because I do eat veggies, but I don't eat grains, and I don't have that. So when I stopped grains, which is oats, even steel cut oats, I lost that weight that was my middle-age spread weight. It can make a difference.
Huge.
Yeah, I can see that now just in the conversation today, the tweaking that I can do that'll just.
Well, you have plenty of room to change,
Yeah, plenty of room to change and just tweak it, and because the surgery can bring you so far, but then now you've got to do it on your own. I just had a comment, Wendy, about the Optifast. I also had to do it for a month, and I found it very liberating to not have to think about food for a month. I thought it was awesome.
That's true. It was very easy, yes, but it was difficult at parties, a baby shower, and not Golden Globe, Academy Award party. So lots of a giant food table, wall-to-wall food, and here I am sipping on my frozen Optifast.
Yeah.
And I was there.
Well, I did it. I was very strong. I did not cheat once in a month.
But Dorothy, can I say that if you prepare your food ahead of time, you're not thinking about food all the time. You're just thinking about it during that food prep. That's one of the liberating aspects about a food addiction diet is you prepare ahead, and then your brain is no longer focused on food during the day.
I do some batch cooking, and yeah, it's very liberating to know that on my way home, I know there's something there. I know that there's something of nutritional value.
Yeah.
So your tiered plan is remove flour, like for a week.
Yeah.
See what happens. Then if not, remove grains. Including flour.
Yeah.
Right, both.
Yeah.
Like, so once you remove flour, then keep flour removed, then remove grains. And then hopefully your life is transformed.
Yeah.
And that's what I would do.
My life is transformed. I just need to tweak it now.
Yeah.
Yeah, for sure. Thank you so much.
Sure.
I would just like to say, David talked about tools, and I have come to learn after 12 years, the surgery was just a tool. I was a sugar addict before the surgery, and I'm still a sugar addict, and I'm struggling terribly. But it is just a tool. So for anybody going forward, it's not just a matter of just having the surgery. It's a matter of getting on with your life and getting some help. Like I have to get help with my addiction because I gained not all of the weight back, but I gained a fair amount of the weight back because I went back to my old eating habits. I couldn't eat as much, but I ate often. And that's, like after 12 years, I still don't drink with my meals. And as Wendy said, a half hour before I eat, half hour after, I don't have anything. But I just want to say it is just a tool.
Absolutely. And we have lots of tools, but you can't, it's a little hard to put in a nail with a wrench. So there's only, our limitations to how you can apply each tool.
So I just wanted to also ask, because the type of food that you were talking about sounds like a keto diet because of the low carb, no carb, high protein or high fat volume. Is it comparable to a keto diet?
So here's the problem with keto. The problem with keto is it means 1,000 things to 1,000 different people. So like there are people on keto that eat pork rinds, as a source of fat and protein. Like that's not what I'm suggesting at all. I'm suggesting that if you eat nutrient-dense food and your diet is devoid of refined carbohydrates, that you can burn fat for fuel. So, but I think the word keto gets, because some people will say, well, I tried keto before, but not as a addiction recovery tool, but rather as a diet. And that doesn't work because it just doesn't, because they're not addressing the actual problem, which is the disease, which manifests as a physical allergy and a mental obsession. So if that's not addressed, it's not going to go away.
If I can just interject, David, but don't go back. If you go on some of these keto sites, like Facebook groups, they're like, wow, I found this amazing cheesecake thing that's no sugar, no carb. That's not what that's not a keto diet that we would advocate, because it's still very addictive like. So we're talking about something that's protein and fats and no refined carbs, tweaking it according to your needs, but not addictive. And so many keto plans are still very addictive.
Yeah, so there's something called like a fat bomb.
Yeah.
That's like even the name of it itself scares me. I don't. But the point is, if we're eating real food, and I find that food addicts do well in ketosis. So I don't know what else I was going to say, but yeah. So I don't think that people should be taking things that they used to binge on and recreating them. Yeah. I don't think that if you binged on cheesecake that you should even contemplate making cheesecake. To me, that sounds like a terrible idea. If you have a problem with crackers, don't try to make a cracker out of cheese. You know.
Is that along the same lines as don't give an alcohol-free beer to an alcoholic?
Yeah,
person?
right, exactly. I worked with a guy who helped me come up with what I call my trigger-free triangle, which is like a way to assess if a food is a problem for you. And basically the points of the triangle are guilt. If it causes guilt, debate, or there's some level of romance or rendezvous about the food, then the food shouldn't be included. Like that's like a drug to you. It changes the way you feel. But he came up with this thing. He would say non-alcoholic beer is for non-alcoholics. So it's the same idea.
Right. Beautiful.
He had a way with words. Yeah.
So sugar-free chocolate is the same as
Well, it's
crack
chocolate.
cocaine.
Right. Yeah, exactly. Yeah.
I have a question.
Also another white powder, by the way. Go ahead.
Sorry, you mentioned, okay, so no refined carbs. Does that mean you can have complex carbs like, say, sweet potatoes? Or is that a no as well?
Well, it's hard because it totally depends on the person. I personally don't eat them. I kind of put that stuff, I kind of lump it into the grain category, even though it's not actually a grain, but its nutritional profile is very similar to grain.
Okay, thank you.
Kind of like
All
you
right,
can
so-
turn a potato into potato starch, so therefore you could kind of turn a potato into flour. So that's my theory.
Yeah.
Okay.
So I think that we can wrap this up. We've gone for an hour and 15 minutes now, and I wanted to personally thank Dave and Dr. Tarman for joining us today in this Zoom meeting. And certainly I'll be posting this whole Zoom meeting on YouTube once it gets uploaded, because an hour 50 minutes on YouTube equals 3 hours of upload time. So that's how long it takes. And so I just wanted to thank everybody for coming today, and thank you to Dr. Tarman and to Dave. And if you have any further questions, you can certainly go to their website for the Center for Addiction website, where you can just send an email message or whatever.
You can go on the Facebook page, the I'm Sweet Enough, because we're both on that page. Sugar Free for Life.
Yeah, we're both pretty active on there.
Yeah.
Well, I hope that it was really helpful for everybody to look at it again, a different perspective, because there are all sorts of different perspectives. This way may not be your way, but I just wanted to be able to share different approaches of food management, addiction management, and helping your own journey. As a professional musician, I studied with some of the best horn teachers around the world, but I, didn't necessarily listen to everything that one particular teacher taught me. I took little bits from different people to see what works best for me. And that's what I'm finding, that I'm hoping that people here will also, whatever little bit of information helps you with your journey, that maybe you do need to do a sugar-free, soy-free, grain-free diet. Maybe that's your journey, but it's not something I'm going to be doing, but it's just out there, so that we all know that we're not completely stuck with what our own bariatric team back at our hospitals are telling us is not the absolute law. There are different things that you can do and different ways to look at this whole journey.